Thanks for joining us on a brand new season of Industry Leaders. It's here that we celebrate the success of Aussie businesses, their leaders and how they came to be. They'll tell their story and we'll find out who they really are. In this episode, more than just a trampoline park, ways to improve our community's health and safety. But first, a business that's bridging oral and general health, Sydney Holistic Dental Centre. Industry Leaders, brought to you by Annex Media.
I've certainly been interested in health for almost all of my life. I have been in this industry for over 40 years and I've been in this practice for almost all of that time as well. The Sydney Holistic Dental Centre started in around 1980 with my brother, Dr. Joshua Ehrlich, and we've been in the CBD of Sydney for almost 40 years. And apart from my brother, who I've already mentioned, and Dr. Lewis, Dr. Craig Wilson and Dr. Yin Teo are an absolute tower of strength. Holistic dentistry means that we recognise that the mouth is connected to a whole person, and that whole person has a digestive tract, has a respiratory tract, they breathe, there's posture involved, there's muscles and nerves, and what we do in the mouth affects those things. Chronic inflammation is the common denominator in all chronic diseases, be it heart disease, cancer, diabetes, mental health problems, dementia, even low birth weight in children. And the most common site of chronic inflammation is the mouth. That's why people need to take their oral health very seriously. It's also the gateway to how we breathe. So the size and shape of the mouth literally determines the size and shape of the upper airway. And that predisposes you to breathing problems potentially, or sleeping problems as well. It's such a sensitive part of the body, and so if it's out of balance, then that can have an impact on people's chronic pain conditions like tension headaches, neck aches and jaw pain. Most of those infections have actually, be it tooth decay or gum disease, have no pain associated with it at all. So people could have that problem with their health and be totally unaware of it.
The work culture here at SHDC is really important to us. We try and get together often for dinners or family days at the park. So building, a good relationship with your work colleagues is so important. We spend long hours with each other, so really we're like a little family here, and the happier we are to be together, the better really, and our patients feel that as well. So relationship building for me is one of the biggest things that I do here, because if a patient doesn't trust me, then I can't really help them as much as possible. So once a patient has a good relationship with me, I can really offer advice that they'll probably take.
When it comes to aligning people's teeth, a lot of people think it's just purely cosmetic. And sure, yes, you do get a really nice smile at the end, but the broader the upper and lower jaws, the more space you have for your tongue, and so there's more airway, so you'll breathe better when you're asleep. The other thing as well is that crowded teeth promote more plaque and therefore inflammation, which is not good for your general health. There's now links between gum inflammation and gum disease to heart disease, diabetes, Alzheimer's, cancer, the list goes on. And so straightening teeth and making them more cleanable is actually a really good thing for people's health. A lot of people use the absence of pain as the barometer of good oral health, but in reality, the vast majority of dental conditions don't actually cause any pain whatsoever. And so it's better to be proactive rather than reactive.
I think people like the idea of a holistic approach to healthcare. We are still dentists, but we understand how we, as dentists, fit into an overall health picture. People who don't have a confident smile often have a guarded smile, and that sends out a message to the outside world which you may not want to convey. And the way you are perceived is also an important thing to consider. Just because we can do something doesn't mean that's what the patient needs. So that is a very important distinction, being patient-centred. If we were practitioner-centred, then what we were interested in would be all that we'd be recommending. If it was a symptom-based practice, then we would just be fixing things that appeared. But a patient-centred approach from a holistic perspective looks at the patient's needs and tries to identify what is causing some of the problems that they present with, what are some of the avenues that they can pursue to improve their general health. Very few people come skipping into the surgery, into a dental practice saying they love it, they can't wait to see us, they enjoy the sound of the drill and the feeling of numbness. Nobody does that, not even do we do that when I'm a patient. So we're dealing with the realities of people's anxiety, so it's an inherently stressful and challenging profession. The biggest challenge for me in my journey so far is the biggest challenge for every dentist doing dentistry, really. Dentistry is an incredibly intense profession. It's very focused and we're working in the most sensitive part of the human body. So it is inherently stressful and very demanding technically, and that's something that every single dentist contends with.
Still ahead on Industry Leaders, a holistic approach to dental care and your general health. Sydney Holistic Dental Centre's Dr. Ron Ehrlich shares the 5 pillars of health and wellness to live a life less stressed.
I've actually written a book, and the book is called A Life Less Stressed, The 5 Pillars of Health and Wellness. The book is really a conversation I wish I could have had with every single patient I've ever seen, because it informs so much of what we do at the Sydney Holistic Dental Centre. Now, the podcast came about because once a book is written, it's written. And you want to update that knowledge. And a podcast is just a fabulous opportunity for me personally to ask people that know so much more than I do. So I'm learning more and more all the time. One of the most important innovations in dentistry is that of 3D imaging. And this is a great example of it, an opportunity to take a 3D image of a tooth. We've already looked at the large amalgam filling with some cracks within the tooth, but we wanted to try and preserve as much natural tooth as possible. And so we did that. We took out the fillings, we took out the decay, we took out the crack, and we took an image with a 3D camera, and this is what we have. We draw with a margin of the tooth on the filling on the computer. The computer then generates a restoration, which we can modify using our various tools. And then we place a ceramic block into our milling unit, and there is an image of the ceramic block with the filling which will be milled from that, and we will then fit that in the same appointment to the patient. That's technology working wonders in dentistry.
So to practice good oral hygiene, brushing twice a day along the gum lines where the plaque and where the bacteria builds up is really important, as well as cleaning between the teeth, so using floss or pixters to go underneath the gums and clean that area, as well as under any bridges or any orthodontic wires that you might have.
One of the most important innovations is that of 3D X-rays. A 2D X-ray gives us an image, and we look at the 3D images. We get to look at it in 3 dimensions, looking at it from the top, looking at it from the front, looking at it from the side, and it reveals so much that we would otherwise have missed. So 3D X-rays has been a huge innovation in dentistry. Another really important innovation has been Invisalign, which are these thin aligners that fit over the teeth and are almost invisible. And we can achieve some amazing results. The importance also of mouth breathing and the problem that can occur. It affects balance in the body, of body chemistry, but it also dries the mouth out and makes you much more susceptible to tooth decay and gum disease. Well, probably the most important procedure is the preventive one, which is our team of hygienists which look at gum health. Because while it's the simplest and it's the least costly, it is probably the most important, because gum disease has been linked to so many other health conditions because of the chronic inflammation link. Chronic inflammation is the common denominator in all diseases. So the simplicity of being regular with your hygiene visits are probably the most important. The other one is to do a thorough assessment of a person's oral health status, and that is really important. I think it's an important a step for people to take if they are interested in their health. And so just simple oral exam, comprehensive checkups. We normally set aside an hour for our first appointment to do a clear and comprehensive assessment of a person's oral health and their needs.
For me, it's just a drive for education, and the thing that drives that is patient outcomes and making them the healthiest they can be.
The reason people should take this seriously is because if they don't, not only does it affect their health and they may have no idea why their health isn't improving, but also the treatments become far more complex and expensive. Preventing oral health problems is the key to good oral health, but also recognising them, acknowledging them and dealing with them as they arise is also really important, not waiting for pain. The rewards are huge. The rewards are huge, and that is we tend to fix things, we do repair things, we help people overcome pain that they come to us for, and we have these long ongoing relationships. It's almost like watching time-lapse photography over a person's life, where we get to interact with individuals on a 6-monthly, 12-monthly or often longer periods where they regularly come in to see us, and that's just a huge privilege for any dentist when a patient allows them to care for their health like that. Probably the most important step a person can make in their life, in their own health journey, is to take control of their own health. Your health is just too important to leave to anybody else. So you've got to take control of your own health, and in doing that, information's a really important part of that. With knowledge comes power. And while in our world we seem to be living in a world of increasing complexity, the solutions to being healthy are, I believe, remarkably simple.
Coming up on Industry Leaders, a car accident turned into a light bulb moment for a 100% Australian-owned and operated company. Tragedy leads to one of Anditech's innovations for life, a personal breathalyzer.